Where can you get the BCG vaccine for TB? Have you ever wondered where you can get the BCG vaccine for tuberculosis? The BCG vaccine is primarily used to protect against tuberculosis, commonly known as TB. It is especially available in countries where TB is prevalent or for specific high-risk groups. This vaccine is usually given as a single injection into the upper arm, specifically in the deltoid area. In many countries with a high incidence of TB, the BCG vaccine is routinely administered to newborns. This typically happens within the first month of life. The World Health Organization recommends this practice in regions where TB is moderate to severe. By vaccinating infants early, we can protect them from severe forms of TB, such as TB meningitis and disseminated TB. On the other hand, in countries with low TB incidence, like the United States and some parts of Europe, routine BCG vaccination is not common. Instead, it is offered selectively to individuals who are at higher risk of exposure to TB. This includes babies and children living in areas with a higher risk of TB, individuals who have close contact with TB patients, and healthcare workers who may frequently encounter TB cases. Travelers planning to visit countries with high TB rates may also be advised to get vaccinated. For instance, in the United Kingdom, the BCG vaccine is recommended for newborns and children who are at increased risk. This vaccination usually occurs around 28 days of age for those living in high-risk areas or with family ties to countries where TB is more common. Accessing the BCG vaccine typically involves public health services, hospitals, or specialized vaccination clinics. The availability and eligibility for the vaccine are determined by national immunization programs or public health authorities, based on local TB epidemiology and risk assessments. In summary, you can get the BCG vaccine as part of routine immunization for newborns in countries with high TB prevalence. In low-prevalence countries, it is available through targeted vaccination programs for high-risk individuals. You can find the vaccine at healthcare facilities or public health clinics that follow national guidelines. Since BCG vaccination policies can differ by country and individual circumstances, it is crucial to consult with healthcare providers or local public health authorities. They can help determine your eligibility and access to the vaccine in your area. Remember, the vaccine is given intradermally in the upper arm, and usually, just one dose is sufficient for effective protection.